Hi, my name is Alicia McCracken. I'm a healthcare instructor at the secondary level and am a registered respiratory therapist. In the past, a couple of the different healthcare related jobs I've held, I've been a registered respiratory therapist in the hospital setting, and I've also been a healthcare instructor at the post secondary level as well. I've been in healthcare for a total of 20 years, which blows my mind that it's been that long. But yes, I've been involved in healthcare for about 20 years. 20 years ago in school, you asked if I faced any discrimination from my peers or professors. And, I wasn't aware of anything specifically at the time that I felt was discriminatory for gender. I think the biggest thing that stood out to me as a student is that I was constantly asked about my personal life. Not my professional aspirations like some of my male counterparts. So that was what stood out to me as a student the most. I had some amazing professors that, looking back, really treated us very equally. But it was that question, that constant question like, are you married? Do you have kids? Do you want to get married? Do you want to have kids? Instead of, what is your career plan? And that's really what stands out to me, from being a student. I also feel like growing up and as a younger kid, I always knew I wanted to be in medicine. Wasn't quite sure, what branch that I wanted to do. And it was really interesting to me that it was always assumed that it would be nursing. So when I told people I was interested in medicine, their assumption was that I would be a nurse. So not a doctor, not a respiratory therapist, but a nurse. So I felt like that was very gender related, that if someone who was a male had said, I want to be in medicine, then the assumption would not have been that he wanted to be a nurse. So I found myself constantly correcting people because I knew pretty early on that I did not want to do nursing, as great of a career as it is. That was not my calling. So I spent a lot of time correcting people or even explaining why I didn't want to be a nurse. And I felt like that was very much so based on my gender. So pressure, expectations, I think that kind of sums up any of the pressure expectations that I felt. People were constantly kind of talking about the choosing a career that you could balance a family with. And I find that that's very much a conversation that happens primarily with females, that I don't hear that conversation or I used to not hear that conversation as much with my male counterparts of, will you be able to balance a family? Is this a good schedule for a family? So it's kind of interesting, thinking about the different ways that we're treated, the different expectations that are placed on us, that, you're very aware that things are different. I think in the 20 years that I've been in healthcare, gender equality has transformed. It has completely transformed. I mean, 20 years ago when I started, it was accepted. You didn't say anything. You kept your head down. Even if you recognized it, you're supposed to just let it roll off your back because it's just the way things are. And today we talk about it. We learn about it. We study it. We're open about it, and we're teaching these younger generations and older generations how to handle those situations. I think that we have transformed to a place where no longer is it just accepted as, oh, that's the way it is. It is now, okay, we're going to recognize it and we're going to figure out how to address this and handle it. So I think the education with gender equality has just come so far in just those 20 years, and it's really a great thing to watch. It's a great thing to see. So did I ever face discrimination in my field? Yeah, absolutely. I mean, it's one of those things where when I worked in the hospital, I can very clearly remember being a clinical instructor for a male student. We were close to the same age. He was a little bit younger than I was. I was his clinical instructor for the day. There was a new resident doctor who did not know me. And I remember very clearly going to consult with this doctor about a patient, and he was wanting my opinion. What he didn't realize was it was my opinion he was wanting on their treatment. But he addressed the male student, and that was so impactful to me. And I actually had to step in and introduce myself as the instructor because he was consulting a clinical student, assuming that I was the one who was shadowing the younger male. That was very impactful, very enlightening to me as a young female in healthcare, that a lot of the discrimination that I had received to that point, sometimes I would chalk up to ageism because I was young in a field and I did have a supervisory role very young. And it just kind of brought to light that it wasn't necessarily ageism. It was also, gender equality and some of the assumptions that are made there. I can't tell you that I handled it correctly. I think I just smiled and introduced myself and then moved on, with the situation. I don't know that I knew how to handle it. I think that I was just kind of in this space when I was younger that that's the way it was and it was accepted, and you correct when you can't have a chance, and if you don't, then you just kind of roll with it. I think I've learned a lot in 20 years. I think I've learned to assert myself a little bit more. Some of the other discriminations, are some of those classic, if the female is very outspoken or confident in what they say, then they're too aggressive, versus a male who can say the same thing in the same way and get the same message across. I actually recently spoke to another respiratory therapist who is a male, and he was asking these same questions. Actually, we were having a really good conversation about gender inequality and how it still exists today. And, from his perspective, he was sharing that he finds the doctors come to him over some of his female counterparts that he really respects and knows they have more experience and more education. And he's even noticed, some of the gender equality that still, exist in the field, and that, he can say the same thing that one of his coworkers has also said, but for some reason, because of his gender, he carries more weight with some of the physicians. So it just kind of brought to light to me that that is still an issue. But what I love is that we're talking about it now, that we're saying, hey, it's not okay. It's not just the way it is. I think that that's the biggest transformation in the past 20 years that I've experienced. Not that I don't experience gender inequality still. I think it's there, but I think we're talking about how to handle it and how to change it. And that's great. So thank you for allowing me to kind of share my thoughts.